When I signed up for the program, I didn't know what I was getting into. And it turned out to be something very different from what I thought it was and very different from what I expected. And it turned out to be exactly what I needed, and I didn't realize it at the time. When I first started into the program, I quickly got to the point where I looked forward to every meeting like it was Christmas. It was my favorite part of the year just because I wanted to spend time with these people. There have been a lot of moments that changed the way I think. But the thing I think that changed me the most as a person, the way I look at the world, not just my work, but the world in general, is the guys in our cohort sat down and started talking about race. And it's such a charged issue that you never get an opportunity to ask those questions in an environment where everybody's really looking from a perspective of good intent. And you can't even begin to understand that until you're looking somebody in the eyes and you see that they're still living that they've had all this success, they've done all these things in life, but what happened to them when they were a little kid in a grocery store is still a fundamental part of who they are. And once you realize how fundamental those sorts of things are to people, it changes your approach to how you're going to do anything, because you have to deal with people and the lives that they've lived. You can't approach it from an intellectual perspective. You have to approach it from the stories they tell. My strategic initiative is to put together a multidisciplinary coalition of stakeholders that have impact on community health in rural America. It chose me because I'm from a small town, and I'm from the small town that I'm actually working in now. So it gave me the opportunity to go home and make a difference in the lives of the people that I grew up with. Early on, one of the things that we learned in one of our sessions was about a book that we had read that had to do with engaging communities. And the metaphor that they used was an elephant rider, like in India working in a lumber yard. And the idea being is that the community is the team. It's the rider and the elephant. And the rider represents sort of the rational part of thinking that you'd appeal to with logic and facts and things like that. The elephant is more the emotional side. And of the two, you can get the rider on board all you want to. If you don't get the elephant going, you got a problem. I started out wanting to change access to community health for a few people in the county I grew up in. As I started to dig into that and discover the factors that contributed to it, the need, the issues at hand, and how deep some of those went, I realized that it wasn't about just health. It was about health and how health impacts prosperity and how it impacts the long-term viability of rural communities in general. So what turned out for me to be a community health project has actually morphed into a broader effort to try to figure out ways to help save rural America. I was doing an interview for this once before, and I said, so we were asking these very same questions. What are you trying to do? What is your coalition? What is all this? And after I told him all this, he said, it sounds like you're trying to change the world. And I hadn't really thought about it in those terms, but I thought about it for a second. I said, I guess I am.